On behalf of AARP Vermont, I want to welcome you to the training on equitable community engagement for age-friendly communities, designed for Regional Planning Commission staff and health department staff who are focused on improving the health equity through the built environment. And I'm Kelly Stoddard-Poor, and I lead our livable community work on behalf of AARP Vermont. And that work is really focused on enhancing housing, transportation, community design, support services, which together facilitate the independence and the mobility of older adults to be able to successfully age in place. And we know that changing the built environment to work for people of all ages, abilities, and background is critical to improving our public health and supporting our local communities. It's also a really critical component to building social capital. Just this week, the Surgeon General released a public advisory that we are experiencing an epidemic of social isolation and loneliness. Social connection is vital to community health and success. People with strong perceptions of community belongingness are 2.5 times more likely to report good or excellent health compared to their peers without a sense of belongingness. Social isolation is, if someone's experiencing social isolation, it's equivalent to smoking a pack of cigarettes a day. So it has a tremendous impact on our public health. One of the strategies specifically called out in the report, the Surgeon General's report, was really focused on designing the built environment to promote social connection. So all of the work that everyone here is leading in communities is so important to creating an equitable future. And as you embark or continue the work that you're doing, I want you all to know that AARP is here to support your efforts. So please keep in touch after this training. We want to be able to see more Vermont communities be walkable, livable places for people of all ages and background. So I've had the pleasure of working with Suzanne Kelly and Megan Rodier on this training in collaboration with ChangeLab Solutions. This training is being offered through AARP's Livable Community Technical Assistance Program. And I'm really excited to have Tina Ansong, a senior planner with ChangeLab Solutions, join us today to lead this training. Tina has been working closely with Megan and Suzanne and myself with their teams to put together a really thoughtful training that hopefully will meet your needs when you're working out in the community. And I certainly appreciate all of those who did a lot of pre-work in preparation to come to here today to be present. So before I turn it over to Tina, I'm going to also invite Suzanne and Megan to share a few words. Suzanne?
Thanks, Kelly. And I also wanted just to thank everybody for being here today and just say I'm really excited about this. This is, I think, the first time we've ever had the health department and the RPC staff all in one room. And I just think it's this amazing opportunity to finally be able to talk to each other about the shared goals that we have around building healthy communities and vibrant communities that are connected to amenities and support, like Kelly said, social connectedness. I agree, this is sort of like such an important topic these days and such important work. And I'm really proud of both of our teams for engaging in this and embarking on this effort to making sure that we are centering equity in these projects. There's just some really good energy around this, some really great work happening. And I think that this training today will be a really good opportunity for us to really dig into some of those challenges and barriers and get some really good ideas on how we can continue to work with some of our communities across the state. So just really excited for the opportunity to learn and work together, and appreciate Kelly for proposing this to begin with and offering it. And I hope we just get a lot out of it and continue the conversation into the future after these 2 hours, which I sort of feel like is not going to be enough time already. I'm feeling like it's not going to be enough time, but maybe we can talk about ways to just continue these conversations into the future as we do this work together. So thanks everyone for being here. Thanks Kelly and Megan and Tina. And I look forward to the day today.
Excellent. Me too. I'm really excited. Megan?
Yeah, thank you both Kelly and Suzanne for the excellent introduction. I'm Megan Rodier, Regional Planner of the Lamoille County Planning Commission, and we're working with the regional planning commissions and kind of spearheading this effort on health equity planning. And we recently worked with all the RPCs and some health department partners to develop a health equity planning toolkit, which is on our website, and a lot of you have seen it. If you have not, feel free to check it out. And so we're really excited, and I want to thank the RPCs and the Vermont Health Department staff for joining us. We are just starting to, at the RPC level, move into implementation phase. So taking that planning toolkit now and those concepts and actually
back on the 22nd
community projects. So we're really excited for this training. And I do appreciate all the prep work and the input and the responses that we received in preparation for today. So thank you for being here. And I really feel like we're going to get a lot of value out of this training. So with that, I guess I should probably pass it off to Tina, right? Tina, do you want to introduce yourself and kick it off?
Sure. Hi, everyone. I am Tina Ansong. I'm a senior planner with ChangeLab Solutions. I've been with ChangeLab for a year and a half, and this is the second year I'm participating in this LCTAP program with AARP. So my background is in county and municipal planning for the last 10 plus years. So I have experience with like land use, zoning, housing, economic development, and quite a bit of community engagement as well. So I'm excited to be here and to sort of tell you a little bit more about ChangeLab or work, and hopefully provide you with some useful information and tools that you can use for better community or more equitable community engagement in your communities. So let me.
And as Tina's queuing up her slides, I just wanted to also encourage folks to feel free to use the chat throughout this. Tina has built in a number of opportunities where we'll have conversations, and we'll get into some breakouts later, but I just want to encourage folks to use the chat as well.
Give me a second. I'm just like getting myself situated here. Okay, I think that's good. Okay, so let us start off with some disclaimers, because ChangeLab, we have to make our lawyers happy. There's a lot of lawyers at ChangeLab. So the information provided in this discussion is for informational purposes only and does not constitute legal advice. ChangeLab Solutions does not enter into attorney-client relationships. ChangeLab Solutions is a nonpartisan, nonprofit organization that educates and informs the public through objective, nonpartisan analysis, study, and/or research. The primary purpose of this discussion is to address the legal and/or policy options to improve public health, and there is no intent to reflect a view on specific legislation. Give me a second here. Trying to change my view. Okay. So as an organization, our core strategies are rooted in our values to advance public health equity. And we do that by demystifying law and policy, right? We take that complex legalese and jargon and we break it down into easy to digest, everyday, simple language. And so that the community members, advocates and organizations are better able to understand that information and build their capacity and advocate for the change that they want to see in their communities. We're made of an interdisciplinary team of policy analysts, planners, and lawyers, can't forget the lawyers. And we sort of approach health equity through this interdisciplinary lens. And of course, we try to elevate practical and evidence-based solutions to some of the health challenges that we see throughout our communities. So today, we're going to do a quick introduction to health equity in planning. Then we're going to talk about advocating for health equity, which is tied to like how you can message around the importance for health equity. We're going to do an introduction to some basic community engagement concepts and principles, and then dive into more of the equitable community engagement principles. And then we're going to just briefly describe some more creative community engagement techniques that go beyond the typical public meeting setting type thing. So the first, we're gonna introduce you to the drivers of inequity. So we're gonna first define what health equity is. So health equity is a state where no person is disadvantaged in attaining their full health potential because of systemic or structural issues such as social or economic position, education, employment, housing, income, age, or self-determination. With respect to planning and public health, it is ensuring that you are treating people of all races, cultures, and incomes fairly with respect to the development, adoption, implementation, and enforcement of policies that determine how healthy or unhealthy places are. So the 5 fundamental drivers of inequity, we have structural discrimination, we have income inequality and poverty, there are disparities in opportunity, and then there's disparities in political power and governance that limits meaningful participation. So I highlighted the last 2 on the slide because these are the 2 that community engagement tends to have the highest impact on. So, so what are these disparities in political power? So it looks like different social connections that are tied to income and wealth. It looks like disparate knowledge of the political process and civics and how that whole system works. It is, you know, varying opportunities to participate in the democratic process. You know, like, do you have the time to take off work to go and vote and participate in various other forms of governance throughout your community. Political representation, does your elected officials represent you and your values and your interests? As far as governance that limits meaningful participation, it can look like working at the inform and consult end of the community engagement spectrum, and we'll talk about that a little bit later in the presentation. It's sort of treating community engagement as a task, sort of along this process where you just check the box off. It's having limited opportunities to give input, like it's only the meeting at town hall on a 2 p.m. on a Tuesday or something. It's basically doing the bare minimum. So these drivers of inequity then manifest into various types of inequity. And the first type I want to talk about is the distributional inequity, because this is what we tend to focus on in our work. It is the unfair distribution of resources, burdens, and benefits. This is what we can see, and that's why we focus on it. The way how different neighborhoods or their different resources are spending across one place to another. But I want to ensure that we also talk about the procedural inequity. So procedural inequities occur when public decision-making processes lack transparency, accessibility, fairness, inclusion, and diversity of perspectives. And sure, you can see how community engagement or how civic engagement is done plays a huge role in procedural inequity. Then we have the structural inequity, which occurs when institutions and systems of government lack the processes, practices, policies, and internal capacity to operationalize equity within the organization, right? So the distributional inequity are the results or the symptoms of the first 2 types of inequities, the procedural and the structural. So in terms of places, this sort of inequities, they arise and they cause one place or some places to be livable or healthy versus unlivable and unhealthy. So AARP does a wonderful job of, give me a second. AARP does a wonderful job of highlighting or describing the 8 domains of livability, and those could be categorized into 2 main buckets. So the first I want to talk about is the physical environmental characteristics of livability. So of course that looks like housing opportunities that promote and encourage Older adults is the focus, but I believe it's all adults, because when you advocate and plan for older adults or all ages, it incorporates everyone. So it encourages older adults to reside in their current home or communities for as long as possible. And this ensures that there's a variety of housing type and price point. It includes indoor and outdoor spaces and buildings that are accessible to people of all ages and abilities. And it also encourages people to gather and socialize. It also includes transportation choices and infrastructure that factors in all incomes and levels of physical ability. And lastly, the physical environment includes health and other services that encourage people to maintain or improve their health. But it's not just the availability of those healthcare and other services that's important. It's also ensuring that those services are accessible to all members of the community as well. In terms of the systemic features of livability, systemic features include opportunities and spaces where older adults can share or contribute their skills, whether it is as a volunteer, as an employer, or even as an employee if they so choose at that stage in their life. It's also where they can connect and socialize. It's also opportunities or spaces that allow for intergenerational interactions and creates a sense of respect and inclusion for people of all ages. So now that we've talked about livability and unhealthy places versus healthy places, I want to go. Oh, I heard something. Oh, I'm sorry. I thought I heard someone chiming in. I think is it Malia? Are you trying to say something, or do you just need to go on mute? I'm not sure. All righty. So now that we've spoken about those concepts of livability and inequity, we can talk about how can we ensure that the social determinants of health or livability, how can we address or incorporate that through the planning process, right? Don't worry about like how small this text is. This is just giving you the overall picture of the plan. I'm going to zoom in to each phase of this diagram shortly. So the first phase is your guiding forces. And this is what is existing, what is happening, things that you as planners and public health professionals take into consideration when you're developing any plan. It's basically the base information that you're working with. So it can look like your existing zoning laws. It can look at the demographic changes, economic trends. It can look at what's the state of your state and local budget. Were there any major changes in state and federal laws that you need to take into consideration? Are there any major climate change or climate actions that you need to now take into consideration? So the guiding forces are the things that are existing and that are happening right now. And then that feeds into sort of the long range plan, which the envisioned future should be, or usually is, addressing some or all of the 8 domains of livability. And through those planning processes, our long range plans with the envisioned future of livability in mind, we then devise those goals and objectives that we then try to implement using a number of tools, right? So the tools can be categorized into 3 main buckets. It is policies, municipal actions, and government procedures. So the policies are also like local laws. So it's like ordinances, zoning, but it's also very powerful overarching documents like comprehensive plans, human services transportation plans, master plans, etc. And then you can also implement through municipal actions. It is which projects are prioritized and given more funding, that's also with the budgets, are prioritized in your capital improvements plan. You can have also a number of programs and incentives. You see this with where tax increment finance districts or enterprise zones are located to sort of funnel or drive development in certain areas versus others. but they're also the goals or implementation through, government procedures. The major one can be, are there going to be set standards that enhance community engagement requirements for projects? So that is it. So now that we have a basic understanding of the drivers and the types of inequities and the domains of livability and how they all work together with planning, I want to try and like connect those dots for a second. So the procedural inequities, which affect who has access to participate in the process, and the structural inequities, which control the laws, policies, and regulations. I want you to think things like redlining, blockbusting, restrictive covenants, upzoning, downzoning, minimum lot size, etc. Together give rise to many of the distributional inequities, such as where are parks located? Where are the sidewalks? Are they well maintained? Where do we put landfills and highways? Generally, what is the geographic distribution of municipal spending? So if we use the example of the suburbs, many people were excluded when the suburbs were being developed. And in many ways that was intentional. So how did all these communities develop in terms of design? There's a lack of housing choice, both in terms of type and price point. There's a car-dependent design. There's lack of pedestrian infrastructure. There are either no sidewalks or poorly connected sidewalks. There's separated land uses, so you have to drive to get from one to the other. There's a lack of public gathering spaces. Most of the social spaces in the suburbs tend to be pay-to-play spaces. So that's the first sort of introductory chunk of the presentation. I wanted to open it up for questions if anybody had any additional questions about the information that we just covered.
I don't see any in the chat either.
Yeah.
Okay.
Tina, I just want to mention that when I was looking through some of the feedback that we got from people, a few people actually observed the procedural inequities in their towns. That it just, from what, I mean, I didn't even have a word for that myself. So I really appreciate you presenting this information in this way. So
Sure.
just people kind of seeing that things are kind of happening, decisions are being made in the same way in our towns.
Right.
Sometimes, yeah.
And it's often something that we don't think about. Like I said, easier, people just see the result of that distributional inequity. Oh my, and it's sort of like understanding how different forms of inequities give rise to what we're seeing in our communities every day. So I'm glad that concept connected for everyone. Let's see. Will you be sharing the slide deck? Yes, the slide deck, and there is a recording, and there are several opportunities for open questions. And if there's any question that comes up that is sort of like outside of my wheelhouse and my expertise, I will definitely put it back to the team and get the ChangeLab team to formulate a response for you guys, and I'll send all that over should you need it. So. Okay. Alrighty, so we're gonna hop over to the next section. So in terms of communicating and advocating for health equity, I know that I am preaching to the choir in terms of why it's important, why equity and health equity is important, but how can you message around the importance of health equity for audiences that either need convincing, or, to be quite frank, or feel threatened or forgotten by equity work, right? So the first I would say is that you have to first understand the value system of your target audience, right? And this involves actively listening as opposed to listening to respond, or trying to convince people to have the same values as you do. The latter approach can be quite exhausting sometimes, and sometimes yields very little fruit. So let's jump in and explore some of those values that hopefully will help you be more effective in advocating or communicating the importance of health equity in your plans and projects in your communities. So the first one I'm going to talk about is that health equity benefits everyone. And this is often illustrated using a concept called the curb cut effect. So when you think about this, the curb cut was an ADA regulation that was developed to ensure that persons with physical disabilities that use mobility devices can safely navigate their environment. But certainly, they are not only used by persons with disabilities, but everyone has benefited from this, whether it's a family pushing children in a stroller, skateboarders, bicyclists, people hauling luggage, delivery people. Equity has widespread community-wide benefit. So that's the first value system. I think a lot of people like to think, like how is this going to benefit me? And people are generally self-interested. So that's always a good place to start. The second one I want to talk about is, some people care deeply about fiscal responsibility. I'm sure in your work, you've heard countless times, is that what they're doing with our tax dollars? Or I want to know what you're doing with my tax dollars. We hear that all the time. So, so some people are really responsive to seeing a return on investment of the money or tax dollars that are allocated. So of course, many of you in this room may already know that health inequities are expensive, right? So the economic effects of health inequity are the result of two things. There's the downstream healthcare responses, that is responding to the diseases after they've come about, as opposed to the upstream response of addressing the social determinants of health. So there's the more expensive response to disease, and also the diminished productivity in the business sector. And it is estimated that I believe 17.5% of GDP goes towards healthcare spending. Of course, the other side of this is medical debt. Medical debt is strongly correlated to lower credit scores, which is linked to the ability to buy homes and other consumer goods. And this affects the local economy as well. Racial disparities in health currently cost the US approximately $337 billion in total. And it is estimated to be at, I believe, $1 trillion by the time we get to 2040. And also, young adults with various health conditions are also shown to be less productive in terms of number of missed work days, and also generate higher healthcare costs for businesses. So an important part of economic development or any component like that is ensuring that you have a healthy workforce that can participate and work for the majority of the time, right? So a lot of people care a lot about economic development, and this is how health equity is tied into that. The other another value system is around national security. It's a huge concern for some. So current statistics show that 33% of young adults are too obese to serve. And only 25% of those that meet weight are physically fit to enroll in basic training. So when you factor those two things, only about 2 in 5 young adults meet both the weight and fitness requirements to serve. There has been a 16% increase in obesity in active duty military personnel between 2015 and 2020. And active duty military with obesity are 33% more likely to have musculoskeletal injuries. the spending on obesity related, the Department of Defense spends approximately $1.5 billion on obesity related healthcare costs. And there was approximately 658,000 lost work days due to productivity for military personnel. How many times have you heard this one? We should be focusing on the equality of opportunity, not necessarily the equity of outcomes, right? Okay, well, if you do value the equality of opportunity, we should also ensure that everyone has equal access to recreation and healthy food. So do we look at the distribution of park spaces and where are we spending our park infrastructure dollars? Are those distributed equitably across your counties, cities, or whatever jurisdiction? So in terms of park space, across the country, it is shown that there is both more park acreage in majority white neighborhoods when compared to BIPOC communities, and it's also more park acreage per person in white neighborhoods versus BIPOC communities. The map on the right shows the food desert census tracts across Vermont, and there are 39 of them as of the last data set that I checked. And that is 1 mile in urban areas or more than 10 miles in rural areas in terms of access to nutritious food. And just sort of researching this issue in Vermont, I know there's sort of like sort of inconclusive evidence as to whether the dollar stores filling in that gap in some communities are a good thing or a bad thing. Would be interested to hear the perspective of the people in this room on this issue going forward. Let's see. And of course, the big one, valuing the value of aging in place. Vermont has a strong, thriving older adult population. And there's huge value to be had from planning and preparing to have that population age in place, right? Aging in communities, a strategy that requires housing and home modifications and safety features and ensuring that the community and housing and so forth is accessible to older adults, and that they also have protection from other things like, financial protection and that sort of stuff. So some of those benefits, and Kelly went through some of these in her introductory remarks, and I was like, oh, Kelly, that's half my presentation. So it allows older adults to remain socially engaged with their communities by maintaining access to their existing social networks, religious and spiritual communities, clubs and organizations, etc. Kelly also said this, the impact of social isolation is the equivalent of smoking 15 cigarettes a day. It also leads to a 32% increased risk of stroke and a 50% increased risk of dementia. The prevalence of severe loneliness among older adults living in skilled nursing facilities is double that of older adults that are aging in place. Aging in place also slows the progression of memory loss. The rate of cognitive decline is about 70% less in people with frequent social interactions as compared to those with low social activity. It's also more affordable, and this is also tied into people who are highly motivated in terms of the economic cost or benefits of things. So the cost of a full-time in-home care is less than half the cost of a semi-private room in a nursing home or a private room in an assisted living facility. And of course, a lot of these cost savings can lead to systemic savings when you think about Medicare and Medicaid as well. So I would like to launch the first poll question to the room, which is, which of these values do you think would resonate most with the communities you work with? And that poll has been launched, so you should see it on your screen and would be excited. Let's see.
Okay. Seems like the numbers are staying still. I'm going to go ahead and end the poll then.
Okay.
Oh, a couple more responses coming in. Hold on. All right. Give folks one more second to respond. All right. Okay, I'm going to go ahead and share the results.
Sure.
Okay.
Nice. So we have pretty much a pretty close tie between benefiting the entire community and the economic benefits there. But no surprise, value of aging in place is number one. And I was just curious, as we're sort of getting into the open to discussion part of this section, and you can ask any questions from what we've just covered entirety so far, but would like to know, you know, if you have any questions, why whichever value you chose you feel would resonate most in your communities. It has to do with just the demographic makeup of your community. I see Melanie Needle. Do you want to go ahead, Melanie?
Yeah, hi. It's more of a comment related to the aging in place slide.
Yeah.
While I agree with many of the points that you proposed, I think, I think that they're, very real. There's one thing that I have a little bit of disagreement about, and that is, when you're talking about rural communities and, a senior living alone in a rural community, I think that, that is, that's very socially isolating. So if they're aging in place in a rural community, living alone, that's social isolation. So I think that conversation about, aging in place is a little bit nuanced, especially in a very rural state that, that may not be the best option for a senior, that the better option could be living in, assisted living where they do get that social interaction and direct access to care where they would not otherwise get it if they were aging in place in their rural town.
Right. That's a very good point, Melanie. So aging in place doesn't necessarily have to look like in isolation in your own home. It's also sort of taking into consideration ensuring that your older resident has connections or maintain the same connections they had even within their rural community. So is it a situation where you're going to have social events and you have a senior transportation service that goes around and picks everybody up and we get together twice a week at a common place in this rural community? I don't think it necessarily has to look like taking a person who prefers a rural location for a number of reasons out and into a more urban setting, but I think it's starting to think about how we can maintain those social connections as well. Like what sort of supports can we put in place for that population? But very good point. I appreciate nuance with a lot of these discussions. Thank you.
Okay, thank you so much.
I see Callie Fishburne.
Yeah, I had two comments sort of as well. Well, first, I agree with what Emily put in the chat, and I had also put aging in place as well, because we do hear a lot about, concern from older folks about not having enough senior housing. And many seniors also, like, we just had a forum actually with the Bennington Senior Center to talk about like issues specifically related to seniors and senior housing. And some of them are, not really interested in having like living in housing that's intergenerational. Like, they're open to intergenerational spaces, but in terms of housing, they want to be with other seniors. So I think that's, sort of a tension. Like, there's a housing crisis all across the state and across the country, frankly, but I think, and there's just a dearth of a lot of different housing, workforce housing, but senior housing is definitely one of them. And it's a big concern as the population is aging in Vermont. And in a lot of other places. And my other quick comment was the thing that, I guess Melanie made me feel brave enough to also slightly disagree or politely push back on something, which was the national security argument and a lot of statistics about obesity. I'm just really conscious there's a lot of, anti-fatness and fat phobia out there and bias against, overweight people. And I feel like that's, I don't want to contribute to weight stigma. So I feel like I'm not going to want to make an argument that's like, oh yeah, obesity is, I don't know what I'm trying to say, but basically just like, I want to be conscious of that. Like, just because someone is overweight does not necessarily mean they're unhealthy. So I feel like that's, Monica too, sorry, super problematic. I also just recently read a book about, how, anti-fatness harms health outcomes for overweight people who don't want to seek medical treatment because they're afraid of bias in the medical system and that sort of thing. So anyway, I just kind of want to push back on that and not kind of elevate, problematic stigmas related to overweight and obesity.
Great. I appreciate the learning and I appreciate the feedback. And if anybody else wants to push back and have a discussion, that is great. That's where you sort of get the learning. So I appreciate your perspective on that. And I can definitely see your points that you were making. So I appreciate that.
Yeah, Tina, I'll just mention that I had missed that slide about the weight slide. And we certainly at the health department are also trying to really look at our language and our messaging and really focusing on nutritious eating and physical activity. I think one thing to keep in mind, though, is that this is an area of stigma and discrimination. Okay. And so I think it's relevant here to the discussion because of reactions to people in larger bodies and their place in our world and our communities. So I think we definitely have to be sensitive to that and be thinking about that and how are we designing our communities and our open spaces that are really welcoming to everybody and everyone can feel comfortable being in those spaces no matter what their size is. And it's an important conversation and definitely something that we're thinking about also at the health department.
I appreciate that. Thank you so much.
Such great discussion. I do just want to also respond to the pieces on aging in place, which is so important. And it's, to really be thinking about aging in place of what choice, right? And making sure that people have the choice in the process. And pointed out by a couple of folks that we do have a housing crisis. And for a lot of older adults who find themselves in large single family homes, there's not a lot of availability of housing across the state if they do want to be able to downsize. And often that housing could be located outside of our downtowns or our village centers. So thinking about the need for additional housing that is smaller in space, typically called the missing middle housing, and also being really thoughtful about where we're placing senior housing. It is very upsetting when I see senior housing located out in a very rural area with no connectivity to the downtown or services or amenities just because it was cheap land to build on. So being really thoughtful about the placement and the types of housing that our community needs is so important to a healthy population across the board.
Thank you so much for that point, Kelly. Okay, that was really good discussion. I'm gonna move on. I see other hands up. Let's proceed through the next section and see when we get to the next question Q&A period. We'll see how we make up for time. So I'll just say, not that we're not going to get your questions, but hang tight for a little bit. Give me a second. Okay, so now we're going to transition into the community engagement section of the presentation. So let's start off with some basic definitions, okay? Community engagement is a strategic process with a specific purpose of working with identified groups of people, whether they're connected by geographic location, special interest, or affiliation, to identify and address issues affecting their well-being. So that's community engagement generally. The equitable and inclusive lens or approach or shift to community engagement is sort of ensuring that the people that are most affected and most marginalized, especially those who have been historically left out of these conversations, have a say in the decisions that affect their lives. I know many of you are probably very familiar with this chart, the spectrum of community engagement. And so we have the sort of inform and consult end of the spectrum, which is the least equitable and inclusive. And we move to the right of the table, which is like the collaborate and empower, which tends to be the most equitable and most inclusive. One of the tenets or main aspects of equitable engagement is sort of that power shifting and shared governance. So sharing, shifting power from the institutions, the governments, and shifting them over to the actual community as the decision maker. So for example, with inform, it tends to be just, we will let you know what is happening, and it is more education and outreach more than anything than it really is community engagement. So that can look like fact sheets, open houses, and websites. And then you kind of have consult, which is slightly better, but definitely not great, right? It is, we'll keep you informed and acknowledge your concerns. We're not necessarily committing to doing anything about your concern, but we acknowledge it. And that can take the form of public comments or public meetings. And with the collaborate, it is definitely a more equitable shift, and it is shifting, like I said, the power away from institutions and putting it in the hands of citizens. It is seeing and valuing the lived experiences and expertise within the community. So it's basically, we are looking to you for advice to incorporate your suggested solutions and recommendations as options for people to weigh. And this can look like advisory boards and committees. And of course, the most equitable is on the empower side, which means that you give the decision-making power to citizens, and that is, we will implement what you decide. And this is typically done through either citizen juries or ballot initiatives. So now that we sort of have some basic definitions and ideas out of the way, I wanted to introduce you to, or you're probably already familiar with AARP's and Cities of Service engagement model, which is a pretty great model of engagement. It sort of emphasizes building strong and sustainable relationships and partnerships, creating those trusting relationships and increasing accessibility to facilities and services, and providing a range of opportunities to become more involved. So you're working with the city leadership to identify the challenge, you're working with the community, you're bringing them in, you get to work, you show the impact, you do your evaluation, you set your metrics. The one recommendation I would make to this model is, rather or opposed to starting with leadership, for it to be more equitable and inclusive, we recommend starting with deliberating with the communities, because sometimes you can have sort of like a mismatch between where the priorities lie in the community versus the government institution. So I know some governments tend to shy away from very controversial topics, and they would rather, you know, either put that on the back burner for a while, but it is like top priority for the people living in whatever specific neighborhood or community. So how do you ensure that you have done all that you can do in your power to ensure that you have diverse perspectives incorporated into your community engagement efforts. So you first need to consider the barriers of participation, like what are the factors that are keeping people from participating in whatever event or planning process that you've outlined. And some of these barriers include things like language. A lot of public input processes are often offered only in English in both print and audio. The other one is employment obligations. Many people have to work at the times when public meetings are taking place. So if your meeting is held 2 p.m. City Hall Tuesday, most people are at work, and some people work night shifts and so forth. So if there's the other one is familial obligations, like are you the primary caregiver for either young people or an older adult? Do you have to cook dinner, help with homework, etc.? There's also the accessibility of your venue, both in terms of physical accessibility, but also the accessibility of your materials. Are there materials suited for people who are visually or hearing impaired? The next one, which is interesting, is the value of time. Am I going to give up my time to attend your meeting, event, or whatever, when I could be taking up an extra shift, driving Uber to make extra income? So there's sort of like a time trade-off, like my time is valuable. And these are the trade-off decisions that people are making every day. You have transportation. Is your meeting venue accessible via transit or sidewalks? Literacy can be a challenge in some communities. There's also technology. This is a big one. The digital divide became ever more conspicuous during COVID. So there's also, oh yeah, so there's technology. Okay, got it. So when taking those barriers so when you don't factor in those barriers to participation, you tend to see that the demographic groups that are traditionally excluded from community engagement tend to be immigrants or non-English speaking, undocumented, and refugees. You have racial and ethnic minorities, renters. People often have a question mark about renters. That's because most notifications for public comment or public events tend to be sent to property owners, not necessarily the tenant. So there's persons with disabilities, persons with low income, older adults, single parent household, or just single caregiver household generally, low educational attainment households, and transit dependent households. So with all that being, So with all that being said, it's important, sorry, my mouse is acting weird. Okay, so with all that being said, as part of your age-friendly work, it's important to understand the intersectionality of older adults, right? Because they may have various barriers and challenges that you may not typically associate with being an older adult, but instead is tied to their other complementary identities. So many older adults have not just one, two, but they have multiple. The other aspect of why you should consider intersectionality is that many groups may seem that they have competing interests, but in reality, all want the same or similar things from life or the communities that they choose to live. So when you think about the intersectionality, it allows you to identify your allies for various causes or programs, right? So for example, if you're trying to advocate for better transit service because your aging population is now more reliant on those services, you may not think of large employers or unions that represent low-wage workers as your allies in that fight to get that service started or expanded in your community. And so we talked about barriers. So this is how we can overcome. This is just a quick table that, in the interest of time, I'm going to just say that once the slides get sent out, you can look at these in detail, but I just want to talk about, touch on some of the more important ones, I think. So there's these sort of caregiver obligations or the familial obligations. Most events that factor in or provide meals and childcare or homework assistance is sort of like the top tier, the next level or something, but that sort of account for those things tend to be more well attended. The accessibility issues, we talked about language, interpreters, ensuring that you have ample staff to talk to people in person if there's a literacy issue with a specific population. And you can consider providing various forms of compensation, whether it's be prize, gift cards, et cetera, to sort of entice or incent people to participate. So we have the principles, sorry. This mouse is paying up my existence. Okay, so the principles of equitable community engagement, these 4 principles are sort of coming out of asking 4 basic questions, right? Well, 3 basic questions. The first one is, who is most affected by the issue, right? Those are the people that you need to engage with the most. That means moving beyond the surveys and the consultation that we talked about earlier, and bringing people with lived experience into the room to work together. So that question will help take care of the centering equity and the humility part. The next question is, which voice is not heard? So this gives you a chance to learn about the resources in community or potential partners to work with. The third question is, what do people have, need, or are ready to grow into? So this means that you're inviting people to describe themselves, their capacity for the work, and over time you can invite them to grow their capacity while checking in to make sure that the work continues to align with their interests and resources. And though that last question is tied to the empowerment and collaboration and building trust. So the first aspect principle we talked about is centering equity, right? So identify and locating priority populations. And this is a very, I'm sure, data savvy group of professionals. This data source came from the Vermont Department of Health. It's the socioeconomic vulnerability index, and they factor in older adults living alone, poverty, educational attainment, and the share of people with no health insurance. So obviously the dark blue are more vulnerable than the green and the yellow. And so there's a number of indices. This one from the University of Vermont is a composite of 3 different indices to get that environmental disparity index. So to sort of get the data, you can work with the county that is well represented in this room, or you can even tap into your educational and university resources to help you map data to sort of identify those groups. So what do you do after you've located where these priority populations live? The next step is for you to ensure that the process of engaging with this community is responsive, inclusive, and culturally appropriate, right? We talk about building capacity of these organizations. So it's identify which community-based organizations are meeting the needs and servicing the populations after you've identified and located them. And we talk about authentic engagement, meaning building capacity and empowering, but it's also important for you to build the capacity of your public health department, planning department as well, to understand the implications of race, culture, and socioeconomic status in decision-making. So with these partnerships, there tends to be a number of benefits, right? These community-based organizations or grassroots organizations can provide historical, cultural, and technical expertise. They anticipate inequitable outcomes. They can persuade citizens to participate and attend engagement events. They can provide additional support through co-hosting or facilitating. They provide insight into issues not currently on the radar of many people who are not living in those communities. And they ensure that the communications are suitable and understandable for the intended audience. So it's very important when you're engaging with these organizations that you are very clear and transparent about roles, responsibilities, and your capacity for incorporating the change and suggestions. You need to be very transparent about what can and cannot be done. And you need to ensure that there's adequate advanced dialogue between the agency, like public health planning, and the community-based organization. And the issue of compensation comes up quite a bit. I know there's, funding is limited, but a lot of these organizations are doing work, and some level of compensation will go a long way if you have that in your budget to factor that in. So the other one is valuing lived experience. We often talk about having data-driven evaluation and problem solving, and sure, we do that quite a bit as planners with all the census data and the like. But it's very important to incorporate lived experience. And lived experience is sort of expertise that doesn't come from training or formal education. It is knowledge from an experience, direct experience with an issue or challenge. It is direct experience with a system, process, or issue that you're trying to engage with a resource. And it's also awareness of what works and what doesn't work, and what resources, whether formal or informal, are available in the community. So it's sort of like using the three types of data together to drive how you're evaluating process and making and coming up with solutions and then implementing those solutions. So it's not valuing one, like the sort of quantitative data, the statistics or the expertise of the staff, more so than the lived experience of the people who you're bringing into your process. So in terms of empowerment and collaboration, there are a number of shifts that need to take place, right? We need to shift away from working for the community, which means I'm the expert and I'm going to implement all these things. I'm doing it for your own good. You should be happy, versus I'm going to consult you to figure out what your priorities are, figure out what your needs are, what's the best approach in terms of solution implementation, and how can there be feedback loop, which we're going to talk about shortly, instead of just a one-directional type of feedback. It is also shifting away from short-term engagement timelines. We tend to have engagement be tied to a specific project, like, oh, I'm doing it for this project, I'm doing it for this plan. But the engagement with community should be a constant thing. It should be long-term, and it should be more of a relationship, which is what we're shifting towards, as opposed to just outreach where I am, which is more the sort of inform and education type of thing. I'm just letting you know what's happening. Instead, you're shifting towards building more sustained, authentic relationships. We're shifting away from one group benefits, which tends to be either the most connected or the loudest voices in the room. And hopefully we've brought in diverse perspective and diverse voices. And so there's a whole community benefit, and there's a more equitable distribution of those benefits and burdens that we talked about earlier. And I mentioned this earlier as this one-directional form of community engagement, as opposed to a constant feedback loop. So you're constantly evaluating how your plans, the impacts, how it's being received, and that constant feedback loops then informs future projects and so forth. So trust, one of the most important aspects of this. They say everything moves at the speed of trust, and trust is very fragile. So it takes a long time to build or rebuild, and you can lose trust with the snap of a finger. So this is the trust equation, and it talks about the various components of trustworthiness. So if we sort of break that down, the first one I'm going to talk about is credibility. So you need to have demonstrated that you know your stuff. So the information that you provide is accurate and beneficial. Transparency is so important. So you are fully aware of what your people are fully aware of what your plans are and how you plan to engage with them. And the most important part is if you come to a conclusion or a decision, people have to know exactly what went into that decision-making process and how you came to that conclusion. Reliability, which is basically you do what you say you're going to do. And when a certain community group has expressed a need for a particular thing, that you have demonstrated that you're willing to respond or investigate at the very least what those concerns are. There's also openness. So you're open to new ideas and ways of doing things. You're not just there to try and maintain the status quo. And of course, integrity. So you've demonstrated, you have a demonstrated history of being honest and conducting yourself in an ethical manner. And this is all over the orientation, which is your focus on the community's needs, interests, and perspectives at all times. So that is sort of like the North Star of everything. And I'm gonna open up for questions, or we can take a 5-minute refresher break at this point. Kelly, what do you think?
Well, I know that Heather Danis had her hand up earlier. So Heather, do you still have a question?
Just a there we go. Just a quick comment. Sorry, just on the weight bias and national security conversation. Like, I totally support all the comments around weight bias, but I just didn't want us to lose the thread of planning, community design as it relates to physical inactivity and poor nutrition, because those are definitely connected to national security. So I wouldn't want us to kind of throw that concept out completely, because regardless of weight, inactivity and poor nutrition have created challenges for the military. And I'll throw in, there's an interesting recent article or journal that was published. The military does use some specific BMI and weight cutoffs, so we might wish that they didn't do that, but so just to acknowledge that's in the resource that I'm going to share, but I just wanted to make that one point.
Great, thank you, Heather. All right, I'm looking at the time here and thinking it would be good if we could do a 3-minute stretch bio break for folks, and then we'll come back, and I know that we'll be going also into breakout sessions shortly as well. We've got a little less than an hour, so I know we have a lot to go through. So if everybody could be back at 2:43, that would be fantastic.
Awesome.
All right, Tina, are you back?
Oh, I'm sorry. The slides
That's
after
okay.
power mapping are a quick sort of run through. But yeah, I think 8 to 10 minutes
Okay,
would be good.
perfect.
Yeah.
All right. All right, so it's 2:44. Why don't we go ahead and get back into everything, and Tina will go over the power mapping exercise, and then we'll go into some small group discussions.
So I wanted to introduce you guys to the concept of power mapping because I think it's a good example of how you can tie all these concepts that we've talked about so far together. So for example, it involves thinking about the values of people that are on this grid that I'm going to talk about. It's also will help you to understand how to communicate and advocate for your policy. It certainly factors in intersectionality in terms of which groups may benefit from the policy and how we can bring them in as a partner or advocate. And it also brings in the concept of building relationships and partnerships. So what is power mapping? So power mapping is a visual tool used to understand who has more or less power in a community in relation to a particular issue, and by extension, a particular decision maker. So power mapping helps you identify who your allies are and can sometimes be used to identify who has influence on the players. It also might help you oppose your who might oppose your plan or who is in the middle of the issue and that you may have room to sort of convince to bring over to your side. So the typical way of doing this is you create a 4-quadrant diagram, and you have on one axis, you have people who strongly opposed on the left, whatever you're planning to do, and you have people who strongly support on the right. And then you have the most influential, and that is in relation to the decision maker, who's usually at the center where you see this power mapping label there in the center. You usually put the decision maker there. So the higher up are the most influential and most powerful, and the lower down, the lower are least influential and least powerful. So you have 4 quadrants that have various degrees of influence and support, right? So you put them based off of those where they would lie on this spectrum. And so what is involved in the process? So it helps you to, again, those values, you'd have to like think about what your decision maker has at stake, whether what do they have to gain or lose by saying yes or no, or by supporting a particular policy. So you'd have to do some research. I call it researching your target. So what do they stand to win? Try and figure out what has prevented them from saying yes so far. Let's see. In terms of like crafting your approach, it can help you think about when you really think about the values and stuff. If you can focus on helping the decision maker to understand your position, not only by providing facts, but also putting the facts into context. I think what does this policy mean for their constituents or whoever? You also need to provide research and data, because this often provides cover for a lot of elected officials, where it's like, we're supporting this policy because the data shows that it can yield X and Y. And it sort of comes at, it gives them the appearance of being totally neutral and objective, right? There's also finding the opportune times. Is it time to revamp the comprehensive plan? That's how Minneapolis got their elimination of single family zoning done. It was during the period of revamping their comprehensive plan, and a lot of activists sort of jumped in on that opportunity. So those are the things I want you to think about. This was like the next iteration of that, which is, we'll talk about that, or I can talk about that more, but I really wanted to dive into this power mapping exercise. So I want to copy, give me a second here. I want to copy that Jamboard link.
And I'll let folks know. So what we're going to do is we'll open up the breakout rooms, and all the breakout rooms will be divided up by counties, and you can self-select your breakout room. So you can choose which breakout room you'll go into based upon the communities that you work with. And if anybody has any issues and needs help, just let me know and I can get you into the right breakout room. You should be easily able to go in and out of the breakout rooms, and then we'll come back to the main room.
Right, so I just put a couple of links to the Jamboard. So you should be able to open that Jamboard, and you should see that same 4-quadrant thing. And you can, does everybody know how to use Jamboard? I'll just show you, I'll just give you guys a demonstration here. Let me share my screen. Share. Right, so depending on which group you're in, you can select text, and you can just put it somewhere here, and it could be County A, right, just so that we know which group you're in. And then you can add sticky notes, A, B, C, D, and you can place them, the people that you've identified. You can resize, move them around. And you can also add text to put in which policy you're gonna advocate for here. So this slide on the first frame is just my demo slide, but you can sort of shift over, and they're all blank, and you can just, like call dibs by putting your county name or your group name somewhere on the grid. There's 7 of them. So does anybody have any questions on that?
All
It's
right.
not working.
And Suzanne and Megan, I know that you'll be floating in and out of some of the breakout rooms as well to help folks. So I'll go ahead and
So Kelly, I just want to say 2 things. One is this was why and when we wanted you to have your own examples. So we were first thinking about giving like our own example for everybody to work on, but hopefully in each group you can quickly decide on one policy that might be happening in your area that you can always kind of do this on together. So each policy will be different for each group. And then did we say how long people have for the breakouts?
Yeah, good question. So originally we had planned for 15. So we're gonna scale it back to about 9 minutes or so. I'm sorry about that because we're just running a little bit behind schedule, but we've been having such rich, good discussion and good Q&A. So, but I think it's really, just getting used to the practice of doing the power mapping. So
Should
let
we
me
just,
know. Yes,
before
Megan,
we
please.
break out, you say focus on one policy, so give some examples of that. Like, I think that'd be helpful for people.
Okay, it could be expanded transit service is one that I think of quite a bit.
Eliminate minimum parking requirements.
There you go. Eliminate single family zoning, or things like that. Minimum lot size, like sample, things like that.
Okay. So it could be regulatory, it could be non-regulatory.
Mm-hmm. Yeah, it could be laws or just policies and stuff. So
Okay, thank you.
Okay, I hope everyone found that exercise helpful in terms of thinking about identifying partnerships, bringing people into the fold in terms of your identifying your allies, thinking about people's value systems. I'm not sure if anybody wanted to, first, I'm just going to open it up for questions generally, or ask if anybody wanted to talk about some of the allies that they identified in sort of like bringing into the fold, and what were some of the values that came up for you as to why you feel that a person was either for or against the policy that you're proposing. I see, let's see. Was it the smoke-free sidewalks? That is slide 4. That was, you guys really got to move in the 8 or 9 minutes there. So I noticed one that said libertarian board members and decision makers as strongly opposed and most influential. Do you want to talk about which values do you think that that particular group has that would cause them to be strongly opposed? Anybody in that group?
Well, since I threw that sticky note up there, I guess it can be me. And I think what all those values that underlie libertarians, you know, I think we've worked with that angle of, so you may not want to have your personal rights and liberties trumped on, but you might we've tried to turn that argument around our conversation to thinking about other people's rights and health and benefits. But so we have worked that angle in the past with, sadly, no success.
Really?
I will just stop there and not share the really what was shared, but so we've attempted that angle.
Oh, because that's what I was gonna say. Because my understanding of libertarian values is so long as you're not infringing upon other people's right to exist. So that's interesting.
It's what got us out of committee and to the Board of Aldermen, but then the buck stopped there.
Okay. Does anyone else want to share out some of the discussions that they had in the groups about identifying partners or people who might oppose the policies that they're proposing? What was on your sticky that you put up there?
We identified the neighborhood groups are not in my backyard. NIMBYs as being probably the most powerful, strongly opposed. Ours was the increasing public transit.
Okay, I got it. And what was the value or the reasoning, do you think, that people wouldn't want transit in their neighborhood, right? It's sort of like, oh, this is an amenity. Why wouldn't you want this transit amenity in your neighborhood? I mean, I've encountered the same, but I just wanted to hear what it's like.
You know, well, car-centric culture with a concern of like, oh, who's going to be at these bus stops near my house?
Mm-hmm.
And are they going to be safe?
Oh, okay.
Are those people going to be safe, you know, to be around?
Mm-hmm.
Do we want them gathering at a bus stop?
Yeah. Do you think they would be responsive to the opening up of opportunity and independence for people living there, or people living like in the suburbs or wherever, whoever like doesn't have existing transit service? Sometimes we've pushed it to say that, hey, you don't have to drive your teenager around everywhere.
That's a good point. You know, I really think it depends on the community, because I think some communities are a lot more open to it than others.
Yeah. And I think there's also a statistic too that fewer and fewer young people are learning how to drive and get driver's licenses. So
that's good to know.
Yeah.
I kind of noticed that too, but I wasn't sure if it was just
more
me,
than anything.
Yeah.
Let's see. Also, what are the aesthetics of the bus stop? That's a good one. Some communities may care more about the look of a bus stop in that area. That is very true. Like, is it a really nice shelter or just like a pole in the grass? Very much. Yeah, that's a good point. People like things that are aesthetically pleasing. They see it and they're like, that's not so bad. So yeah, this was all really great. So the next, give me a second here. Where is my PowerPoint? Oh, there it is, the one hiding. So the next step or phase that you can do to this is what you call like relationship mapping. So you find the most influential person, or you put the decision maker, Mr. Local Official X, and then these arrows demonstrate relationships. So the black arrows are the ones that have a high level of influence over the decision maker. And the red arrows are the direction that the decision maker has more influence over that person, right? So it's understanding, is it a two-way thing? Is the decision maker influenced or influencing those partners that you've identified? So this is the next phase of that. So
Tina,
yes.
sorry to interrupt. You're not in presenting mode, so it's the.
Oh,
it's a
I'm
little
sorry.
small. Yeah, that's okay.
There we go. Hold on. Oh,
There. Oh, no, it went back.
wait. F. Where is? I usually use F5. Hold on. We'll just. This is okay. Oh, past it. Okay. So, right. So I was just describing this whole relationship mapping here, and I want to ensure that Suzanne has the opportunity to say a few closing words at the end. So in the next step, we're just going to talk briefly about some community engagement methods and strategies and techniques, some more creative one that sort of go beyond the typical public meeting. Like I was reading some of the comments in the chat. Yes, public meetings are so boring. As somebody has put so many on, it's like grasping for straws to like keep people engaged and stuff, where you just like, look at my board here, don't you want to look at my maps? So some other techniques, one of which is called graphic facilitation. You've seen this come up quite a bit in various communities. So it's in that meeting, somebody is drawing or illustrating as things comes up. This is an example from the Richmond, Virginia comprehensive plan. And they created this fictional character, which is this 6-year-old girl, and sort of created an idea of how she would go about and navigate her space and what kind of experiences they wanted her to have in their community. So it's tied to things like her housing, her recreation, her family, and things like that. And so these sort of eye-catching things are much better at like pulling people in. And when you talk about literacy as a challenge, when you talk about nobody really wanting to read very long technical jargon, this is a great alternative to that. Too long, didn't read. You've seen that, you've heard that so many times, right? The other one is anonymous polling and feedback. So this is very good at getting people's honest, uncensored feedback. It has a higher response rate and it avoids the social desirability bias, right? You just go along with what you think the group wants you to say and agree with. And of course it protects against intimidation, but you're just not going to get that richness, that lived experience really sort of data, but it's great for gathering in-person, in real-time statistics. Some use these polls in real time at various meetings and stuff. If you were a child of the 90s, they did this a lot on Ricky Lake talk show, her audience quite a bit. So there are various small group facilitation techniques, like when you think focus groups. So it allows for deeper discussion and more complex topics to come through. You're less likely to have a whole meeting disruption or a whole meeting takeover. If that's ever happened to you, it certainly happened to me. So if a person is a little bit dominant or disruptive, you can do all the things by sort of setting ground rules up front, ensuring that people speak one at a time, exhibit respect for one another. But some people are more responsive to that sort of cueing than others. And so if somebody is really going to be disruptive, it's sort of limited to one table in a whole room as opposed to the entire meeting or room. And it also allows more people to speak and give input. Some people are very intimidated by the mic and standing up in front of a large room of people, right? So this is crowdsourced feedback. There's a link here, which will be in the slides when I send them out. They have a really nice, it's called Maptionnaire. It's a really nice tool that allows people to tie surveys into a geographic location, so you can get that feedback, like what's your experience of riding a bike here, what's your experience of taking the bus here, could you provide a more information on that? So it's like tying survey data to location data in the two, and that can be very helpful. And it's one of those online things where you don't have it, you tend to get more feedback on, but of course there's the digital divide. That's going to be the downside of using methods like this, so that always has to be factored in. It should definitely not be your only source of outreach. There's things like photo voice, and this is really using or recruiting and bringing your community members in to document their experiences with certain things. Here's another like transit safety example, like take a picture of what this is like for you. How's this experience with you? You sort of not just describing using words, but tying visual representation through photos as to what that experience is, which tends to be more impactful than words on a page, right? Meeting people where they are. It is attending the after school lunches, the bike to work day, Mother's Day Zumba. You hear all the various types of audit, walk audit, transit audit, bike audit. And when I send out these resources, I have quite a bit of information on how these audits are useful and what's the best way to utilize them. So I'm going to stop there today. So, oh yes, and I wanted to ensure that these sort of meeting people where they are, it's also ensuring that your community engagement happens over a length of time as opposed to a point in time. So once you're meeting people where they are, it's like, are you going to be at the grocery store where I shop every weekend for a month? So it's like, okay, I have 4 weekends in the month. Like if I run into you, I'm going to see you there. I don't have to like carve time out of, you know, like make an appointment to come participate in this thing. You're going out into the community, meeting people where they are, and you're going to be there. Your presence is going to be there for a much longer time. So people don't feel like, oh, I missed it, and stuff like that. So I'm going to stop there and turn it over to either we can do 1 or 2 questions, or before I pass it on to Suzanne for closing out.
Couple hands. Madison?
Yeah, I don't know if I have a fully formed question here yet, but I guess more of a comment. In the kind of business DEIJ worlds, there is kind of the concept of the journey of implementing policies and ideas around DEI kind of progressively, so that we're not breaking trust by trying to go really ambitious and failing. And as I've been listening to some of your recommendations and some of your examples, I've been thinking about how so many of our communities might get really inspired by a conversation like this and want to do everything under the sun. And I wonder if you can speak to helping people really prioritize what may be the first step, if we haven't done any of this work yet in our communities, what that first step should be, what the second step might be, and helping people kind of do that prioritization work.
I think you sort of have to involve, you sort of have to start with, again, talking to those members and understanding where their priorities are. Like, you know, presenting things on a spectrum, like what are you most comfortable with here? Do you want to start here? Okay, so let's start making these incremental changes. And I think we saw that with even in Minneapolis, when they did their single family zoning, getting rid of it, it wasn't just, we're going to eliminate single family zoning overnight and, you know, it managed to pass. It sort of started with, oh, we're going to allow duplexes in single family. We're going to, you know, so it's sort of like you ease people into it and you give them that time to see that, oh, this isn't so bad. But yes, I don't recommend like we're going to go all in. You're right. They can be pushed back really hard. So it involves, again, having that conversation, figuring out what the values are, where are they comfortable, and again, researching the mark and figuring out what do you stand to lose if you support X? Why what is keeping you from saying yes? And how can we figure out the compromise of what the middle ground? It may not be exactly what you want in terms of your DEI objectives, But there's a compromise there. And once you sort of mellow and get comfortable and stable in that place, then you start thinking about what's the next step or what's the next thing. So it's sort of figuring out what people have to gain or lose from saying yes or no to something.
Thanks, Tina. I see also Colin has. Hi, Colin. Go
Yeah,
ahead.
hi. So I just this is kind of a broad question, but when I think about participation, it seems like one of the things that pretty consistently happens is that in any conversation about really any issue, that the people who are most active in that conversation are a small group of people who have really strong feelings about what's going on, and that can kind of be on either side, and that you have this generally much larger group of people who don't are not necessarily neutral, but just don't have strong feelings, like aren't that involved or invested in what's going on, and that they're usually left out of the discussion and aren't the ones who are involved in the decision-making process. And so I'm just curious if you have thoughts about how do you kind of reach this, oftentimes very large group of people who don't have strong feelings either way.
I think it's important first to ensure that you're really certain that they don't have strong feelings either way, right? So just because somebody isn't really participating in something doesn't mean that they are necessarily neutral. It could be a situation of, I don't know more about that topic, so I am neutral. I don't understand what the consequences and the benefits or the pros and cons are of a particular thing. So that's where you sort of like having to educate them outright and say, this is why you should care or be more passionate, if indeed they're sort of like, I'm neutral. And the next side to that is, are you getting the same 10 people? I know here in my community, there's a lot of just very wealthy people that have a lot of time on their hands and just has the flexibility to come and show up at every single meeting and stuff. So it's, again, ensuring that you factor in those barriers to participation in the process, so you bring more of those voices in. So it's sort of like educating and bringing more people into the fold. Why should I care? Why should I be more passionate about this issue? What do I have to stand to gain or lose? Does it affect a certain group that I care deeply about? Am I a parent? Does it affect how my kids get to school safely? Do I, it's those types of things. Some people, I find that most times people just aren't even aware of what's going on, and things just slide under the radar quietly and get passed and stuff like that. So yeah.
Any other questions or comments? Okay, I'm not seeing any hands or comments in there. Tina, thank you so much. This has just been a wealth of information and just has really gotten me to be thinking differently. And I just want to thank you so much for working with us and bringing this training to Vermont. And thank you to Suzanne and to Megan for the collaboration and bringing your teams here today. Before I turn it over to Megan and Suzanne, I do just want to highlight a couple of high-level things that AARP is here to help support. One is walk audits. I love doing walk audits. I also do trainings for volunteers who want to go out and lead neighborhood or community walk audits. So get in touch with me if that's something of interest that you have, or you have a group of people who want to go out and do walk audits. Also, same thing for park audits as well. We have another really great tool for doing park audits. And zoning. Zoning is a big priority for AARP when it comes to the need for more housing. So if that's something that you're interested in taking on in your community, we have 120,000 members across the state. And that outreach and communication with them, I think, is really critical when you're taking on big issues like zoning reform. And then just a couple of other funding opportunities. We have our annual community challenge grants, which are focused on improving livability within communities. Those come out every year in January. And then our state office, we do winter placemaking grants. They're really small micro grants that come available after Labor Day, that are easy to apply for and not a lot of reporting requirements. And also my colleague, Michelle Bailey, who is on the call as well, they have a great animating infrastructure grant that's out there, which is also another terrific form of funding. So I will go ahead and turn it over to Megan and Suzanne to close us out.
All right, thanks, Kelly. And I also, I think, just want to thank everybody for taking the time to be here today. I feel like this is a whirlwind of great information that we probably could have spent 2 days digging into and talking about. I think one thing that I would like to be able to do is just have a conversation, certainly with Megan and Kelly and Tina, maybe if you have time too, just to think a little bit about, and now what next steps. Really want to keep this kind of momentum and these resources going. And really use some of the concepts that we've learned here today. But lots to think about, lots of great tools, resources, ideas, and I'm looking forward to kind of seeing what's next in this area for us. Megan, you're on.
Thank you, Suzanne. Yeah, the last thing I just wanted to say, thank you, Tina. Again, that was an excellent presentation. And thank you, Kelly and Suzanne and everybody for your coordination effort on this training. I'm really excited about this because, like I said, the RPCs were all kind of entering this implementation phase of the health equity grant that we have with the health department. And we're also going to be putting on regional trainings in our prospective regions. So this has been really valuable. I think, those of us who haven't hosted those trainings yet will take, feedback from this training and certainly utilize, if you don't mind, some of your content from the slides, and just, this has been wonderful. So thank you. Appreciate it.
Excellent. Well, thank you, everyone. And we will make sure that we get the recording out, the slides. And I know Tina and I connected. There's a number of great resource links too that she'll be able to share out where in some of these areas where you want to be able to dig deeper, which will be helpful for upcoming debriefs and or trainings. So thanks, everyone.
Thanks again, everyone. I appreciate you. Okay.
Thanks.
Have a great afternoon, everyone.
You too. Bye-bye.
Come on.
Thank you.
Thanks.
Yeah, I think that went
Yeah.
well. I think that was just really great. A lot of information, but I think really good.
Yeah, absolutely. Oh, hold on. I just want to stop the recording real quick.
Yeah.